Here is my examination room. We'll also be going into the bathroom.
Did you get the floor in the back of the couch?
Oh, good idea. I will now. Oh, I definitely didn't show that before. Okay, I'm glad you said something. Okie dokie. Maybe one more time back there. Okay. We'll get started. Okay.
Let me scoot over a little bit. There we go.
Ready?
Yeah.
Okay. Hello, I'm Nurse Lola. It's nice to meet you.
Nice to meet you.
What is your name?
My name is Quinn Kish.
Oh, amazing. It's great to meet you, friend. So I'm your nurse today, and I'm going to do a comprehensive physical examination. Are you okay with that?
Mm-hmm.
Okay, great. As we move through the examination, just let me know if you're in any pain or if something's making you uncomfortable or if you want to stop for any reason, just let me know, okay?
Okay.
Okay, great. So, can you tell me your first and last name, please?
My first name is Quinn. My last name is Kish.
Great. And what is your date of birth? Please don't give me all the real information.
02/12/02.
Thank you. That is my birthday. So where are you?
In my house.
Great. Do you know what day of the week it is?
Saturday.
Great. And do you know why you're here?
I was asked to be.
Awesome. So you're in the male times 4. You are 23 years of age and you appear your stated age. You're well groomed. Your mood and affect is appropriate for the situation. Okay, so I'm going to start with your scalp. And I did my hand hygiene. I'm going to come over. I'm going to palpate your scalp. And I'm looking for any pain, any tenderness. I'm looking for lesions. I'm seeing that your hair is well distributed over your head. I'm looking behind your ears. Your cranium is symmetrical, which is great. So no pain or tenderness on palpation?
Mm-mm.
Okay.
I'm all good.
Okay. I'm coming back over. I'm seeing that your base is symmetrical. Your skin is warm to the touch, which is great. Sorry, I just touched my own hair there. Okay, so I'm going to palpate your sinuses. Let me know if you feel any pain or tenderness, okay?
Mm-hmm.
Okay. So I'm not feeling any edema. Your skin is warm to the touch. There is no dryness and it's appropriately moist. Your skin is also appropriate coloring for your ethnicity. So you don't feel any pain upon palpation?
Nope.
No? Okay, great. Okay, so I'm going to feel your temporal arteries. Okay, they're palpable. Okay, great, both temporal arteries are palpable. Okay, so now I'm gonna place my, oh, you can look at me. Now I'm gonna place my hands here. I'm gonna ask you to open and close your mouth like this.
Mm-hmm.
Don't clench your teeth together.
Okay.
When you do this, so don't bite down. Let me know if you feel any pain when we do this, okay?
No pain.
Great, so I don't feel any clicking on either side. I feel the bones coming in and out very smoothly. That's great, okay. I'm going to feel your lymph nodes? Okay, I'm not feeling any palpable lymph nodes so far. And do you feel any pain?
Mm-mm. I'm okay.
Okay, good. Okay, so now I'm gonna place my hands here and I want you to clench. Okay, great. I can feel the clenching on both sides. Perfect. And then I'm gonna push down on your chin and try to keep your jaw closed, okay? Okay, great job. So I have done your scalp, your face, head. So now I'm going to do your eyes. So I'm going to take the light, I'm gonna bring it over on both sides. Are you ready?
Mm-hmm.
Okay, great. Perfect. Your pupil constricted, and your other pupil constricted appropriately. That's great. Pupil constriction, and your other pupil constricted. Amazing. Okay. Will you look straight for me? Thank you very much. Currently your pupils are about a size 7, which is quite large, but the room is a bit dark right now. I'm not seeing any edema or puffiness over either eye, which is great. The sclera of, do you mind stepping forward a little bit for me? Thank you very much. So the sclera of both, and I'm gonna bring the table over so I'm not hunching. Okay, would you mind scooting over that way for me? Okay, thank you very much. Okay, so I'm gonna pull down on both of your lids. Okay, great. So the conjunctiva on both sides is moist and pink, which is what we're looking for. Your sclera in both eyes is white, and I see some, no redness, they're just white. Okay, you have, your irises are blue, both pupils are round, so pupilla is intact, both irises are round. I'm seeing an even distribution of lashes on both eyes, on top and bottom, and also an even distribution of data on your eyebrows, so it's great. I'm going to palpate your lacrimal glands and lacrimal ducts. Let me know if you're feeling any pain or tenderness, okay? I'm also not seeing any, oh, is your ear okay?
Mm-hmm.
Okay, I'm also not seeing any watering of the eyes. How's that?
Good.
Okay. How about now?
Good.
Great. Okay. Now we're gonna move to the bathroom so I can look inside of your eyes. Okay, thank you. Okay, the light has been darkened. Okay, I'm gonna start by looking in your right eye. Oh, thank you, your left eye. Okay. And the red light reflex is present, which is great. Okay, I'm gonna come back in, get a closer look. Okay, so let me see if I can get a better angle here. Okay, so the red light reflex is intact here. I'm not seeing any opacities. Okay, so the optic disc is, a pale yellow color. I'm seeing a slightly smaller cup inside the optic disc to So the optic disc is on the nasal side, and then on the temporal side, I'm seeing the macule, and that is a bit of a darker red color. The retina overall is this light red color. I am seeing retinal vesicles. I am not able to identify between the arteries and veins, but I know that the arteries, if I could see them or distinguish them, would be showing, sorry about your eye, that the arteries and veins would be showing a white line through them. And I'm not able to see this, so let me come in on your other side. Are you okay?
Yeah.
Okay, sorry about that. Okay, oh, I see the red light reflex, which is great. Let me get in for a closer look. Okay, so I also see the macule on your temporal side that is a darker red color. The overall retina is a like light reddish color. I'm seeing veins and arteries in a normal 2:1 ratio. I'm seeing the optic disc that is yellow, the light yellow on the nasal side, and I'm also, oh sorry, I just know that hurts. And I could also see the cusp. So you can come on out. Oh, let me get my glasses back on. Sit down back on the couch, please. How are your eyes feeling? I know they're pretty sensitive.
They're fine.
Okay. So I was able to visualize the red light reflex on both eyes. I could see the optic disc of both on closer to the nasal side, then about 2 disc lengths away, going temporally. The macule is present. I'm also just going to test your corneal light reflex, and I'm seeing that the light is present in the same place in your iris on both sides, so that's great. Okay. And because I could not identify between the veins and the arteries, I couldn't tell the ratio between them, but typically it's a 2:1 ratio. Next, I'd like you to hold this about 11 to 15 inches away from your face, and you can just pick any page and read off the title, please.
Hiking time. Oh, hikes out of Hans Peak.
Great, wonderful. Okay, so now we're gonna do the Snellen eye turn, okay?
That works.
Yeah, so you can come over here and stand on the 10-foot mark. There. Okay, so now, well, I guess you can't see me if I do it that way.
You want me to hold the camera?
Maybe. Okay, so you're 10 feet away. We'll start on the top and go down, and please cover
One of my eyes?
your right eye for me.
Okay.
Okay.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F P O T E C L E F O D P O T.
Okay, great. So you just missed one letter here, but overall it's a 3.5 on that eye. So will you switch your eyes for me, please? Cover, occlude your lip. Great. And you can start at the top again, please.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D D E F T O T E C.
Okay, you can stop there. So, right here you got the 2025 as well, and then I'll point to a color, and will you tell me which color it is?
Blue.
Blue, okay,
Red.
great. Thank you so much. You can go and sit back down. I think I've got you. Yeah, I've got you. Okay. So I'm going to start looking at your ears, okay?
Mm-hmm.
So I've seen that your eyes are symmetrical in your face, which is great. Both ears also, can you tilt your face forward, please? Both ears are also symmetrical. I'm feeling the appropriate. Do you have any pain?
Mm-hmm.
Palpitation?
Nope.
Okay. Great. I'm gonna look and pull up the ear and back. Oh, here, stand straight for me. Pull the ear up and back. Okay, so overall the canal has a little bit of earwax. It looks, there's no redness, there's no drainage, which is what we're looking for. Okay, I can visualize the tympanic membrane. I'm seeing on the cone of light on the right side, the tympanic membrane is a pearly gray color. And I'm not seeing any, and it's intact, so there's no perforations, no drainage, which is awesome. Oh, and let me switch out this for you. Here you go for a new one. Okay, I'm also seeing the external ear canal. On this side, so I'm not seeing any redness or swelling. There's a very small amount of earwax. So the external ear canal is looking good. I can see, well, hold on a second. Okay, I can see the tympanic membrane. I'm seeing the cone of light in the 7 o'clock position. And it is not perforated. And there's no drainage or ICA in your ear. Sorry, did that take a little bit?
Mm-hmm.
That's great. I'm gonna perform some hearing exams now. So if you could occlude one ear for me, please. Great, perfect. I'm gonna say 3 words behind you, and will you repeat them back to me? Do you understand?
Mm-hmm.
Okay.
1 beak 5.
Okay. And include the other ear. Thank you. 6.
6L7.
Yep. Great job. Okay. Now I'm going to take this tuning fork. I'm going to pluck it. I'm going to place it right here, and I want you to tell me if you can hear the vibration equally in both ears. Do you understand?
Mm-hmm.
Okay, great.
Seems equal.
Next, I am going to pluck it. I will place it here. Tell me when you stop hearing the noise, then I'll move it in front of your ear. And then again, I want you to tell me when you stop hearing the noise. Do you understand?
Mm-hmm.
I'll do that on both sides.
Okay.
Oh.
Stopped hearing it. Stopped hearing it.
Okay, so first one for bone conduction, you heard that for about 12 seconds, and the second one you heard that for about about 20 seconds. So that's close to a 1-to-2 ratio, which is what we're looking for. And we'll go and do the next ear. Are you ready?
Mm-hmm.
Okay.
Stopped hearing it. Stopped hearing it.
Okay, so that was about 10 seconds to 20 seconds again. So good job. Okay. We have done your head, your eyes, your ears. Let's move on to your nose. I'm gonna get you a new one of these and throw out those two. Picking your boogers now. Okay. So, looking at your nose, I see that your nose is midline, which is good. On your face, I'm gonna just take, would you mind scooting forward again, please? Thank you. Okay, so I'm just gonna gently look in your nose. Okay, Okay, great. So I'm seeing that the internal mucosa is red, which is normal and it's a little bit shiny. I'm just gonna take a look at both. So it looks like you have a deviated septum and deviated towards your left nostril. Will you occlude one nostril and take a breath in and out through your nose for me? Okay, and will you occlude the other nostril then? Take a breath in and out through your nose. Okay, so both airways are open and patent, but your right nostril is able to inhale and exhale much more easily than your left nostril. Okay. Fantastic. Okay, you can sit back again. Okay, so I'm going to examine. Oh, will you close your eyes for me? Okay, thank you. So I'm gonna hold this in front of your nose and you just let me know what you smell, okay?
Coffee.
That is correct. Okay. Okay, so will you open your mouth for me, please? Okay, I see that your lips are your lips are moist. Will you please step forward again?
Oh.
Thank you. Okay, open. Okay. So I'm seeing your mucosal membranes. They are pink and, oh, that was a yawn. Okay. They are pink and moist, which is great. I can visualize your hard palate. It is a little bit wider, and there are also there's some texture as well. Then I can visualize your soft palate as well. Can you stick out your tongue for me, please? Like that. Thank you. I'm seeing a small, potentially a lesion on the left side of your tongue. Is that causing you any pain?
Nope.
No? Okay. Will you lift your tongue up, please? Okay, the bottom of the tongue, I can see vessels, and it is shiny and smooth, and the top of the tongue is textured and rough. I'm gonna look at your teeth. Your teeth are white. Great, they are intact and straight. When you bite, will you take your bite and will you pull your lower lip down for me, please? Okay, and it looks like you have a well-aligned bite. I want you to open your mouth and go, ah, and I'm gonna look for your uvula to rise. Okay, and you don't have a uvula or tonsils. Why don't you have uvula or tonsils?
Because I had them removed.
Okay. I'm going and test the gag reflex. Is it typical for you to have a gag reflex since you've gotten your uvula and tonsils removed?
I haven't tested it really that often.
Okay.
Really. So, no.
Good. Okay, and there is no gag reflex present. Okay, so I'm gonna come here and I'm going to palpate your thyroid or arteries. So I'm gonna come under your chin here, come down. I'm gonna find this mound of cartilage. Put my hands right underneath it. Okay. And can you swallow for me? Okay. One more time. Okay, so I was able to palpate your thyroid. Very exciting. I didn't feel any nodules or any irregularities when I palpated. Did that cause you any pain or tenderness?
No.
No? Okay, we'll palpate for. Okay, and I'm just feeling for. Okay, I'm not able to palpate or to feel any lumps or nodules there, so that's great. I'm gonna come in here, wrong artery. Okay, I'm able to palpate it. Okay, great. I'm also gonna listen to both arteries and make sure that I don't hear any bruit or pushing sound. Okay, that side is perfect. I can't hear any wishing or brewery on that side either. Okay, so continuing down, I am going to listen to your lungs now. Okay, would you mind kind of sitting right that way? Great. Okay, I'm gonna pull up the back of your shirt a little bit, is that okay?
Mm-hmm.
Okay, here, maybe you can turn even a little bit more, or even stand up maybe, and turn around. Okay, great. There, I'm just gonna check for equal expansion on both sides. Oh, sorry. That seems to get that. Oh, okay. Put you together here. Okay, and take a, oh, still can't see. Okay, and take a deep breath in for me. Okay, one more time. Okay, good job. So I'm seeing equal expansion on both sides. Will you turn, continue to turn? Perfect. Okay, you can sit back down, a little catty corner for me if you will. Okay, and I'm going to listen to your lung sounds. I'm going to compare both sides. Will you take a deep breath in through your mouth and out, and take it a little bit deeper than you typically would.
Okay.
Okay. Begin. Okay, that was great. So I was able to compare lung sounds. They were even. There was no crackling. Can I do the front? Okay, breathe in. Oh, sorry, you went a little fast. So do you need to take a break and take some normal breaths really quick?
No.
Okay. As I go to the next one, then take your next breath for me, so I can listen to the full cycle. If you need to take a break, just let me know if you start feeling lightheaded. your lung sounds were clear and equal and off fields. I'm just gonna, you'll stand up, but go up a little straight. Okay. Your shoulders are symmetrical. Earlier I saw symmetrical lung expansion. You are not barrel chested. Okay. Now let's move on to some range of motion testing, okay? Okay.
Stand up.
Yes, stand up, that would be great. Okay, so we're gonna start with your shoulders, your elbows, your wrists, and your hands. Okay, so I'll explain it and show you the movement, and then you can follow it after me, okay? So first for your shoulders, you're gonna put your arms back like this. Okay, will you do that one more time for me? Okay, I didn't feel any clicking. Do you have, is this painful at all for you?
No.
Okay, great, you can come back. Okay, you'll go above your head, hands together. Okay, great. And will you go down and do that one more time? Okay, great. Go down. Okay, then take your hands, palms facing the back of your head. Great. Is that uncomfortable and moving for you?
No.
Okay, and then behind your hands like this. Okay. So that is all adequate range of motions for your shoulders. Will you put your arms down by your sides? Okay, so now I'm going to test the strength of your shoulders. So I'm going to apply resistance to the top of your shoulders, and you're going to give me a shoulder shrug up. Okay, ready? Shoulder shrug. Great. Okay, so now we'll do your arms. So bring your elbows up like this. Great, and come down. Awesome. So that is normal range of motion for your elbows. You'll come up just with one arm. So what you'll do is I'll apply resistance here, and you'll come forward, okay? And then after that, I'll apply resistance here, and you'll push down. So to test your arm strength. Okay, pull. Great. Okay, down. Okay, awesome. Side, pull. Okay, down. Oh, okay. Maybe a little strong for me. So you had normal, typical range of motion for your arms, and your strength was equal on both sides. Okay, so now you can, we kind of need a table. We'll go to the table after and do the table parts. So if you'll take your hand up like this, okay, and we're gonna go wrists down, and then wrists back up. Great, and then now we're gonna do finger range of motion. So come down like this, come up like this. Okay, great. Now we're going to windshield wiper the hands. So we can just do one hand at a time for me. And then do this one. Okay, great. And give me a fist. Okay, extend. Okay, great. And then if you'll take your fingers, your thumb, and go to the base, touch each finger and then the base of your pinky. So can I watch that? Oh, okay. Base of each finger. Okay, great. Then will you come over to the table for me? Prop this up on some honey. Okay, we can see you. Okay. So put your hands facing down and lift up for me. Great. Okay, and then go like this. Great. Perfect. Well done. Okay, you can come back on over. We can do the range of motion of your lower extremities.
Stand back up.
Yeah, sorry. Okay, go like this, your knees, so bring. Okay, great, and do the same with the other leg. Okay, great. And then I can see full extension of both legs as they are. Here, I'll bring you this chair. Okay, you can sit down. Then, I don't really know if you can see this. I can bring it down a little bit. Okay, so now I'll test the strength of both legs. So you can all just come out and push forward on both sides, but against resistance for me. Okay. Okay, great. Here. Okay, and equal resistance. Okay, awesome. And they're both equal bilaterally. Then I will, these feet, oh, you take a lunch? Okay, so if you'll stick your foot out and you'll do a point down and flex up. Okay, great, other side, point down, flex up, great. Okay, now you put your foot up, I'm gonna apply resistance. Let's, both of them please. Oh, okay, very equal, very strong. Okay, and then put your heels on the ground a bit. Okay, and pedal me down. Oh, you're very ticklish. Okay.
You got this.
If you want to take a deep breath.
Okay, go.
Okay. Okay, good job. Resistance. Okay, you can come back and sit on. Ouch. Okay. Here we go. Okay, so now I'm going to, since I touched your feet. Okay, so I'm gonna listen to your heart now. Okay. Sorry. Just go with the best way. Can I go under your shirt in the front? You don't need to take it off. Okay, thank you. And just breathe normally. Okay. Sorry about that. Thank you. Okay, so your alcohol rate was 59, and you have a normal and regular rhythm. Okay, I didn't hear any murmurs on auscultation. Okay, so now can I inspect your abdomen?
Mm-hmm.
Okay, so if you'll lay down for me, let's see if they can see this. Okay. So will you mind pulling up your shoulders a little bit for me? Thank you. Oh, okay. So looking, I'm seeing that you have an even skin coloring. Your skin is warm to the touch. Okay. And I can observe your breath sounds in your stomach. I'm going to listen and comfort. Okay, so I was able to hear vowel sounds in all four quadrants. Now I'm going to listen to your vocals and see if I can hear any bushing or brewing. I'm gonna listen to your aortic. Okay. Oh, sorry, I was listening with the wrong side of my stethoscope. Okay, so I'm listening to your aortic artery right now. I can't hear anything, so that's normal. Okay, so I listened for your aortic, renal, iliac, and femoral arteries, and I couldn't hear any of them, which is normal.
Okay.
Okay, so now I also see normal distribution of hair over the stomach and a half diamond shape on the top. And I'm going to do a light and then deep palpation, and let me know if you feel any pain. Any pain on light palpation?
Mm.
Okay, great. Any pain or tenderness on deep palpation?
Mm-mm.
Great. Okay, will you sit up for me? Thank you. Okay, so looking at your extremities, I'm gonna compare both of your arms. Both arms look symmetrical to one another, which is great. Okay, I'm gonna feel your pulse here. That's a +2, it's very strong pulse. Comfortable. Feel here. Also strong pulse, very comfortable. Okay. I'm gonna feel. Do you mind taking off your socks for me? Oh, thank you very much. Okay, feel. Also present. Um, Okay, great. So let's peel palms on this side. Okay, sorry, just get right here. Let me pull here. Okay, both pulses on both feet feel equal, and I'd say about +2 on both sides. This feet.
Perfect.
I'm just gonna feel both your radial pulses at the same time. Okay, great. They have equal strength, and they're occurring at the same time, which is what's supposed to happen. Okay. Would you close your eyes for me, please? Okay. And you just indicate if you feel a sharp or dull. If the stimulus you're feeling is sharp or dull.
Sharp. Sharp. Dull. 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 Sharp. Dull or sharp. 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 Dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. That one's dull. Sharp. Sharp. Dull. Sharp.
Okay, great job. Okay, now you'll close your eyes again and just say now. If you feel something, I'll be touching your face.
Now. 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 Now.
Great. Okay, keep your eyes closed. I'm going to place an object in your hand, and will you tell me what that object is?
Porcelain.
Good job. Do you know what it's of?
Oh, swan.
Okay, good job. It is a familiar object to you. Okay. Will you stand up? Oh, you can. And will you close your eyes? Okay, great. Will you put your feet together and hands by your sides? Okay. Okay, good job. You can open up. You can sit back down. Okay. We'll go over here so I can do your reflexes. Okay. And here's my focus camera. Nope, snacks. Okay. Great. Ooh.
Oh.
Okay, here we go. Oh, I'm so sorry. I'm so sorry. Okay, so point your foot down a little bit. Okay, we'll come to that one later. Okay, so move your bicep. One here, look over. Good job. Okay, and you can kind of like make your arm really heavy and relaxed. Okay, great job. Okay. Okay, other side. Okay, really heavy, relaxed. That's okay. Let's see one time. Okay. Will you come and stand? You. Okay. And hang your arm right here. Okay, and just try to be as relaxed as possible. Let me give it a little. Okay. Oh, sorry about that. Okay, relax. Okay, let me try again. Oof.
Go ahead.
Put your palm to the bed. Relaxed. Okay. Okay. And you can go back and sit down. Okay, if you'll lay back, please. As you put your feet up here. Okay, I'm going to brush this and on the bottom of your on the bottom of your foot, okay? Take a deep breath. I know you feel very ticklish. Okay. You you can do it. I believe in you. Are you ready?
Yeah.
Okay. Okay. I see that you did your best with your plantar reflex. And if you'll do it on this side, and bend your knee a bit, put it over this way, great. Okay. You flex your foot upwards. So, okay, and do the other side, please. A little bit more out. Relax, okay. Okay. Will you sit up for me? Okay. I'm just gonna look at one more time. I see that your hernia is smooth, and I'm not seeing any abrasions on either side. Not seeing any abrasions here.